Good morning, everyone. I am going to give till exactly 7:30 just because I know a lot of people are working and probably giving report, logging on a little bit after they're finished giving report and clocking out. But I just like to give everybody till exactly 7:30. If you are on right now, if you wouldn't mind just turning your cameras on so I can see your face, give you guys credit for your participation. If you have cameras on, that's active participation. Um, and we can compensate you for your time. I'm driving. Oh, no worries, Riley. Yeah, as long as you're not driving, you can, if you're driving, you can leave your camera off. That's totally fine. All right, everybody. So I do want to just, honor your guys' time. We're right at 7:30. Want to get started. Got lots of good stuff to cover for preceptor education. And you're seeing people pop into the lobby, right? Do you have access to let them in? Okay. Um, all right, let me just share my screen here. All right. You can see my full screen. Okay. Okay, guys. So, welcome to our preceptor teams. I'm so happy to see, so many obviously familiar faces, but a lot of people who, we've seen grow up through fellowship are now precepting. It's so cool to see you guys a part of this team. We want to thank you for your hard work, your dedication to the new team members that we're welcoming to our NICU. I know that we're at a place right now where we're asking people to precept, right at a year and a half being off of orientation. But, we have selected you guys for a reason. You have been, shining stars to leadership, to us. Even if you feel like you're at a place right now where, you feel like you might not know all the things, you might not be proficient in, more of like the critical care status babies. We know that you are somebody that would, our new team members would feel comfortable going to for questions, concerns, that you would be advocates for them. I think also it just makes me so happy to see, the people that I've seen come up through fellowship are now are, people that we feel that we can trust with our new team members. So it's a full circle moment for me. It makes me super proud of you. I hope you're proud of yourself because you guys have come such a long way. Your hard work and dedication is filling our unit with safe and caring NICU nurses, which is, the most important thing. So going over, briefly a lot of the things that we're going to cover today. Preceptor responsibilities. So, really staying connected. Preceptors should be present 100% of any care tasks that are involved with your patients until the final tier of orientation, which we'll get into the tiers and more specifics. But I like to start with this comment really to just, drive the message home that I think that we get into the habit that our unit is very busy. And I think that a lot of times it's like a divide and conquer kind of a mentality of like, you go do this, I'll go do that. And sometimes that is, just what the day calls for. It's what is needed. But just as long as this isn't something that is a consistent um, norm for you and your orientee. We want you guys to be there 100% of the time, or at least 95% on the days that are super crazy. We understand that needs to happen, but we want you guys to be there for them. For the questions that they may have, to not put them in uncomfortable positions, for not only the safety of them but of you and your patients. debriefing with your orientee on the progress or challenges you experienced together that shift. So I think that always having a debrief with your orientee of how the day went, and we're going to discuss that more in detail of like how to have those conversations. And then of course, immediate escalation of any, safety concern or warning signs to the clinical mentor and nurse leader. Again, we're going to talk about this in more detail, but want you guys to know that we are always a safe place. That's why we are here. You shouldn't be alone in the things that require, maybe some more tougher feedback to give. So that's what Jordan and I are here for, what our education team is here for. What the unit supervisors are here for. So we'll get into more, content about this in further slides. So this slide is a little bit busy, but I'm just gonna, hit some of the high points and also pop off of this screen to show you guys some images of some forms that we have. So the fellowship binder. So a lot of you guys are familiar with this from being on fellowship, from precepting, or maybe just seeing some orientees on the unit, but we actually give them a fellowship binder. It's a little 3-ring binder that we have them carry with them throughout orientation. They do, we give them right out the gate the expectation that this should be something that they take on the floor with them, they keep in their locker, they take home, whatever. But it needs to come to every biweekly check-in that we have with you guys. Within that fellowship binder is our TSAM objective form, which we are going to get into this in further slides of what this looks like. The expectation from our preceptors is that this does need your initials, dates, and signatures. This is really our final sign off on, for those of you that are familiar with the fellowship health stream modules. There's a health stream module that is the TSAM, the NICU TSAM objective module that's on their health stream. We need this objective form back for us to be able to complete and remove that health stream module off of their to-do list. So that is the expectation of the preceptor, to go through that objective form, the hard copy, and put in your initials and the dates as well, and then a signature on the back. Again, we'll go over what this actual objective form looks like in coming slides. We also have a TSAM checklist. So we will actually, the health stream checklist that a lot of you are familiar with, it's very long, very daunting. We took that checklist and we broke it up into tiers of TSAM, which again, we'll go over what TSAM is and what it looks like in further slides. But it really is just a navigational tool for you guys to be able to look and see, are we really moved on from tier 1 to tier 2? Have we checked off all the things that we need to? And we can, say that, we're officially in tier 2. So it's a nice little navigational tool for you, which I will show you guys what that looks like as well. And then the assignment tracker, this is the orientee's responsibility. Again, this is a sheet that's in the binder. We really only ask to see this when we get an orientee or preceptor pairing that comes in and says, I really feel like I need to work on time management, or I'm not getting the acuity that I feel like I need to. This is a nice resource tool for us to use to see, like, okay, how many, many shifts have you been in the SBU? How many bubble babies have you taken care of? 3 babies, feeders, things like that. And then the last sheet is the biweekly QR code. This is something that may be a little different for you guys. The biweekly forms that we use to fill out are now a QR code that takes you to a Teams doc, which I'm actually going to share with you guys what some of this looks like right now. So I'm just going to stop sharing that screen. So the checklist. Jordan, can you see this? Yes. Okay. So the checklist is, this is what the checklist looks like. So again, it's broken into tiers, tier 1 through 5, which we'll go over what those tiers look like, but we break them down into the actual aspects of what we want covered in those specific tiers. So for tier 1, really covering fundamentals, assessment, and thermoregulation, along with communication of parents. So nice little things that you can actually like physically check off with them. That safety checks. Yes, we know that she knows how to do her safety checks. She knows how to check her ambu bag, her suction, her line. lines, so on and so forth. And that goes down through tier 1 through tier 5. I'm not going to waste a lot of time going over the specifics of this because it is a very long list, but just want you guys to know what this looks like and that it is a really nice navigational tool for you guys to use with your orientees. The other tool that we talked about was the assignment tracker. So that's this tool right here. So the NICU assignment tracker, so we break this down into their weeks. So weeks 1 through 1 through 12 for our fellows, new to specialty nurses, and then 1 through 16 for our new grads. But then we have these nice little categories up on top for their, again, this is the orientee's responsibility, but it's nice just week by week. They go through, they put that they took care of 3 babies, that they had, PO experiences, that they had higher acuity experiences, central lines, things like that. There's no right or wrong way to fill this out, but it's just nice for, if you guys do come to us and say, hey, we're needing X, Y, and Z, we can refer to this assignment tracker to see what they've actually physically had in their assignments. And then the biweekly QR code. This is just like a little, QR code sheet that's in the back of their binders. You guys will scan this and it will take you to a Teams form. So I'm going to show you what that looks like as well. So, one second. Okay. So when you guys scan that QR code, it will take you to, one second, it won't look like exactly like this. So it'll actually look like this. This is what the mobile, a lot of people will just scan it on their phones. And it'll say Children's and Pediatric Service Line BM form. Another thing that will sometimes pop up on here is a little note that says 90 minutes. I don't want you guys to freak out when you see that. It does not take 90 minutes to fill out this form. We have to put a timer on it for it to time out. So once you guys log on to this form together, you have 90 minutes to complete it. So it is something that you can scan. If you get caught up in something, you can return to the form. Just make sure that you leave it up. It does not take 90 minutes to complete. That's just the timing out of it all. The orientee will fill out their name here. They will select what applies to them, if they're a new grad, a fellow, or if they are a NICU, experienced NICU nurse. You'll fill out the care site here, which were IFMC. Unit name, you'll put NICU, and then you'll put your preceptor name here, and then the date of your biweekly check-in. You'll also put here for number 7, what week of orientation that they are on, and then who you are meeting with that day. So we reach out in the fellowship family emails and let you know you'll be meeting with Jordan, you'll be meeting with Carly on this date and time. So you'll just put here clinical mentor. If you're meeting with one of our fellowship support team members, you'll put that down here and other along with their name. Like, basic thing to remember is that we will reach out prior to let you know who you're checking in with, but that's just what you'll fill out there. For their tiers, you'll put in what tier you feel like that orientee is currently operating in, tiers 1 through 5. If you feel like they're between tiers, you're not really sure what tier that they're in, it's just fill out what you guys are feeling like you're in, use that navigational tool for the checklist. If you're, kind of questioning where we're at, but then just fill out where you feel like they're currently operating. You do need to fill this out together, just more so in the sense that you can only do it on one phone. You can't do it on 2. So the orientee will take the phone at that time and they will grade themselves 1 through 4, 1 meaning they're not meeting objectives, 4 meaning that they are working independently, and they will grade themselves within each tier. Again, if you do not feel like, we're at tier 5 yet, that's totally fine. But if you feel like that there were some times where they were handling tasks that are within tier 5, you can grade them on that. Again, there's no right or wrong way to fill this out. It's a conversation. So when we're in the check-in together, you can tell me, like, hey, Carly, we're definitely not in tier 3 yet, but there were some opportunities where we got to see some discharges, we got to see some admissions. So I did grade them. I gave them, a score of 2 because they needed some intense guidance on things, but they did great and they got the experience. So Again, no right or wrong way to fill these out. There is an opportunity to talk about ANOVA mission and values, willingness to learn, asking appropriate questions, and recognizing when assistance is needed. Anticipates trends in patient condition and manages competing priorities and tasks. I really love this section because it is a section that, this is for the orientee. Always want to see their self assessment versus, your self assessment. But I really do look to you guys to tell us, if you feel like someone's not willing to learn, you're feeling like you're really having to prompt, you're really having to, uh, make sure that they're asking questions, that they're not recognizing when assistance is needed, they're just doing things. I want you to score them fairly here. But, if they're doing well, they're doing independently, giving them the fours that they need. Um, but really do look to this section here to make sure that we are, working professionally and appropriately with things. There's always a section for, the orientee to share, like if they've completed all their health stream modules. This just like, is a nice little section for us to make sure that they're up to date on all modules and things are being turned in on time. And then this is your section here. So again, same section as the orientees, but your opportunity to score and to give feedback on, the tiers 1 through 5. But then also, like I was saying, the ANOVA mission and values statement, the willingness to learn, asking appropriate questions, so on and so forth. A nice little reminder here for you guys to check HealthStream. And then there's just these open-ended questions at the end. So we like to ask the orientees the most recent experience that they learned from, what went well, what was beneficial, or where were opportunities of improvement. It just kind of gives us a nice little moment with them to figure out, if a learning and teaching strategy isn't working well, if, they had any, opportunities where they learned from, challenges, barriers, and so on. Number 17 are their weekly goals for weeks 1 through 2 for the next like 1 to 2 weeks. So really just going over there, what their goals are. And then any assignment requests. If there's anything that you guys are looking for, this is the opportunity to kind of create that little wish list, which we're going to be going over that, we've kind of changed our ways of how we're coding assignments for orientees and preceptors. You guys have priority over assignments as being an orientee and preceptor pairing. So this is really where we can start, making those moves to seeing what you guys need to see. And then that's for professional practice. So that's really what it looks like I like to show it on like the mobile view, just because a lot of people will use their phones while on the unit. Okay, any questions on those tools? All right, awesome. So kind of going into biweekly check-ins. So what those look like. So with the biweekly check-ins, that's when you guys are going to be filling out that QR code form, that Teams form. This is a meeting where the preceptor, orientee, and mentor will meet every other week during orientation. The way that we schedule these is if you are on night shift with your orientee, they will either be scheduled between, the earliest I've done is 5:30, 6, or 6:30. We try to do them on the like 30 increments because we usually don't take more than 30 minutes for a biweekly. Those will be scheduled. Again, we'll put those in the fellowship family emails telling you, hey, this is when we're going to meet. This is the time. If you are a night shift time frame, please just prioritizing, making sure that you are available for that time. Patient care is priority, but at least reaching out to Jordan and I if you are not able to make that early morning time frame. We do make accommodations to come in this early to meet with you guys. We don't like asking you guys to stay after report. That's why we come in so early. But we do things in our schedule to get there that early for you guys. So just being considerate if you're not able to meet, if something is going on, just communicating that with us. I know a lot of you guys have my cell number. I can send out another little email with Jordan and I's contact information for home, just in case you guys need that. But just always communicating with us if you're not able to make that night shift time schedule. If you are checking in with us during day shift, we will call you at the beginning of the shift, ask you what your schedule looks like for the day, and then make plans to meet around your schedule. Always reach out if we can reschedule or you have any conflicts. I always do. I really appreciate when people will reach out. We have so many people that we check in with, but it's nice when people do reach out and say, "Hey, I just want to let you know this is my first shift back with this person." If especially if it's not a night shift one where you have at least the whole shift to kind of get an assessment of where that orientee is at. Sometimes we don't have the ability to reschedule it, just depending on Jordan and I schedules. But it's always just nice to know, like, "Hey, I haven't been with this person. Or they've got, a shadow experience. Like, can we, move it to a different time?" We're always open to looking at it. There might be a reason that we also scheduled it that way. The QR code, the biweekly form, we went over that together. Again, you can find that in the fellowship binder. When you see that 90-minute timeout, don't think it takes 90 minutes to do. That's just our little disclaimer, that's how long it takes to time out. TSAM understanding. So we're going to go over TSAM, what that looks like in the next coming documents. But really this is just like slowly putting on, like, slowly adding skills to the orientee's plate as they're accomplishing new skills. They're moving on through different tiers, but they have access and are part of every part of the assignment, that we're not just dividing and conquering. You take this patient, I take this one. And I think it's really done wonders for our unit and our new grads, our fellows, our experienced nurses. It's been a nice, I think, change. Feedback. So again, escalating to mentors, educators, and NICU leadership, no matter how small, we want to know everything. So even if you feel like this is the first week, 2 weeks you've been with this person and you're starting to see some real red flags, you're starting to kind of get some feelings that there's more to dig up here, that maybe you don't feel like they're interested in the patient population. You have really been, having to prompt them to be involved in the patient assignment. Even if you feel like it's something that's like really little, we want to hear about it. We don't jump on every opportunity. Just because you come to us and say like, "Hey, I have this feedback," doesn't mean we jump on it right away. It might just be something that's nice for us to have in our back pocket, for us to take note of, and then to, get further feedback later down the road. So please bring us everything that you have. Feedback in real time and prior to check-ins for mentor awareness. So really this just means that, like, we really need to get this feedback. If you are having concerns, we want to know about it in real time. Please do not wait even a week. We might miss an opportunity to have a feedback conversation with this person. As a lot of 12 to 16 weeks flies by. We have a lot of people that are like, "I just wanted to wait a week. I wanted to give it some time. I, wasn't back at work." Again, we're just missing opportunities here. So please always reach out, shoot me a text, send an email. You don't even need to talk to me over the phone. We really like to have feedback written down. Written feedback is ideal and always appreciated. You can just write me an email or a text and send it to me. It's as simple as that. Support. So being the welcoming face and resource to our new team members, always being kind and inclusive, and inviting them to lunch, inviting them to sit with you. I know a lot of you like still remember that feeling of being new, and just being invited to sit down for lunch together, being introduced to, your preceptor's friends. Those are all things that everybody remembers, and it makes the change. For you to really feel, included and part of the team. So creating that supportive foundation for their success here. So healthy habits. So like right out the gate, when you are starting with your orientees, we want to be instilling healthy habits. And this is, even down to arriving to work on time and appropriately. If you feel like your orientee is, we tell them that anytime after 7, that they're clocking in is considered late, because when they're new, we don't want them rushing into work. We want them coming in with an even mind, not rushing in, that they are taking their time getting ready, that they're there for huddle, that they're like abiding by the proper dress code, that they're wearing the appropriate things to work. I know that sounds crazy, but I did have to give feedback that someone came in wearing like a tube top to work, like it happens. So like just making sure like their belly shouldn't be out. They should be wearing like our navy scrubs, pediatric scrub tops. If you have questions about dress code, you can send them to me. But just making sure that, and we do a lot of times get feedback from preceptors that, hey, they continuously, they're like rolling into work when like during report. So if that's happening, please let us know that so we can check time cards. Safety checks. So right out the gate, we have a small group with them that we have the first week that they're here, where we go over safety checks with them, and we, you know, multiple times tell them that safety checks are their responsibility. For shifts on the unit, we want them checking the safety equipment, and that being the first thing that they are getting used to, because that's just so important, like such an important part of our day. Um, as they're doing it though, tell them to have them, talk through what you're doing, because they can, be lifting the ambu bag off the arm and looking at something, but you don't really know that they know what they're doing until they're verbalizing to you the things that they're checking. So just make sure that you're having them talk through what they're doing, and we're ensuring understanding. Um, I think talking through what they're doing is a huge, not even just for safety checks, for everything. I feel like a lot of times people are like, precepting is a lot of talking. When they are, exercising a skill, they're doing something like safety checks where they've gotten education from us. They should be doing it independently. Have that be the time for them to talk through the things that they're doing. Have them talk through a hands-on care. You don't have to be the one that's talking 100% of the time. Let your voice rest, because you are talking a lot as a preceptor. I think that when we have people talk through the things that they're doing, it really does bring to light if they are actually understanding why they're doing certain things. So that's always my tip and trick. I love doing that as a preceptor, just to make sure that, we're on the right page. Ensuring that they're instilling organized habits and expectations. So that means clean and tidy rooms and tidy babies, restocking their carts for the next shift, making sure their baby is nested, developmentally appropriate, and the baby looks tidy. I feel like when parents come in, they see their baby looking disheveled, covered in spit up, their bed's covered in spit up. It's just not a good look. It doesn't make the parents feel good. So making sure that your orientee is doing those things right out the gate. And restocking carts, it's just considerate. I know that you guys know what it feels like to come on to shift and open a cart that's, just totally empty. So make sure that they're doing that. Going in early, being on time for hands-on care. So what does that mean? On time means that they are starting the feed by the care time. So they should be going in early, however early they need to be going in. Allow them to do that. Just as long as, if it's a teeny baby that we're talking about stimulation time, they shouldn't be stimulating that baby for more than 10 minutes for actual, unswaddled hands-on care assessment. But if they need to go in early to, set up their bedside cart, this is a nice little picture that we show them in their first class day. I like them to set out all of their materials that they need, so they're not running in and out of the room for different materials. They've got all the materials in the order in which they're going to carry them out, so that they stay in an organized flow and they have all the materials they need. They're not running in and out of the room for materials that were forgotten. If we feel like we're having time management concerns, I do always, the first thing that I'm going to ask you as the preceptor is, what is going on in the room? What are you seeing them spend the most time on? Are they running in and out of the room for supplies? Is their hands-on care head to toe, clean to dirty? Are we all over the place with that? Because a lot of times, yeah, again, being a part of the 100% of their care tasks is so important for things like this. When we run into concerns, we want to know what you're seeing. Okay, so what is TSAM? So for those of you that haven't gone through TSAM, haven't seen, our TSAM models, new to precepting, TSAM stands for Tiered Skill Acquisition Model. It's based on building concepts from simple to complex. Really, ideally, the orientee will have the full assignment throughout the entire orientation period. Even babies that are, they're more acute, level of care is higher, we're still doing vital signs on those patients. We're still grabbing all the materials for hands-on care. They're still a part of the assessment. Yeah, maybe they're not weaning on drips. They're not, leading the team with care planning, but they are a part of those assignments still. So the orientee will be responsible for certain objectives within that assignment for whatever tier that they're in. The preceptor will be responsible for everything else. As the orientee moves through those tiers, then they'll gradually assume more responsibility as they move through tiers 1 through 5. So this is a nice little diagram and model. We give them this diagram for in their binders as well as a nice little example. But it has tiers 1 through 5, what the orientee is responsible for, and then what the preceptor is responsible for. I'm not going to get into the weeds too much on this just for time saving. We are going to go into the TSAM objective form, which is more NICU specific. But if you have any questions on this model, please let me know. I'm happy to answer them for you. We are going to go through the specific tiers in the next couple of slides, though. But I think this is a wonderful model and that it truly breaks down very simplistically tiers 1 through 5, what the orientee is doing, and what is like helpful objectives for the preceptors as well. Okay, so this is what the objective forms look like. Again, this is going to be in the binder for your orientees. You can see here what I was telling you guys is your responsibility is the preceptor initials and dates as objectives are being accomplished within the tiers. So for tier 1, the main concepts that we are hitting are vital signs, assessment, cares, and documentation. So really things that are specific to NICU are going to be things like thermoregulation, going over the isolate with them, skin temp versus air control versus open crib, our hourly roundings, our safety checks, what are a part of our bundles, demonstration of correct positioning and handling of an infant, making sure that, you know, our babies, again, are put back tidy, developmentally appropriate, things like that. Again, there's this nice little column of preceptor responsibilities, introducing the orientee to the team members, modeling best practice for initial cares and behaviors, demonstrating time management and prioritization, narrating the cares to the orientee, talking through what you're doing. You just completing a task in front of them doesn't allow them to actually understand what you are doing and why you're doing it. Debriefing. A debrief is so important for them to take away what went well during that shift or what were areas of improvement. You know, either for the shift and things that couldn't be controlled or for things that they were doing. Reviewing their skills and orientation pathways on HealthStream as always, and then, you know, just building on your assessments, showing them what an abnormal assessment is versus a normal assessment. And I think even, you know, if you're having a very run-of-the-mill day, everything is going as planned, everything is, you know, is going wonderful, talking about the abnormals. What does an abnormal day look like? You know, it's eye exam day, it's Tuesday, perfect example. You have a baby that tolerates it fine, nothing goes wrong. What does a day look like when a baby doesn't tolerate it? What are the things we're avoiding? What are the things we're trying to not overstimulate the baby? What are the you know, the signs that we're looking for there that they're not tolerating things? So then once they've accomplished everything from tier 1, you feel like they're handling vital signs, assessment, cares, and documenting independently. Then we move on to tier 2. So tier 2 is going to be medications, orders, milk preparation, feeding, and specimens. So these are all going to be things like, you know, feeding orders for babies, labs, doing heel sticks, proper labeling of labs, how to use our beaker, proper handling of milk, proper handling of the IV pumps, hanging fluids, supplies, things like that. Things that go along with medications are 5 rights, making sure that they're looking things up on Neofax as a reference. That they're doing in-pass scores if we're doing, you know, pain management. Again, we're getting into more complex skills here and making sure that they're not losing those skills from tier 1. They're still handling assessments, the documentation, the vital signs, the assessment, but now they're adding on these skills for medications, milk preparations, handling orders, handling labs. Tier 3 is going to be more high risk procedures, care planning, and communication. So they're a part of trio rounds. They're a part of, you know, communicating with parents, holding the phone, escalating to providers when needed, collaborating with consults, whether it's speech, PTOT, and then the more high risk procedures. So I mean high risk procedures, but we are talking about, you know, placing NG and OD tubes that we're making sure that they're seeing PIC placements, that they're seeing UV placements, that they're going on field trips, but that they're also starting to develop that critical thinking here, that we're trying to connect the dots of all things, that that they're seeing patient status, patient labs, they're looking at x-rays, and they're able to correlate that to the patient condition. We start to like have them start to practice and just get into that teetering of working the muscle of critical thinking. Because I will say, just for those of you that are newer to precepting, critical thinking is a very complex skill that, especially for our new grads, they will not be critically thinking at the end of 16 weeks. It is proven evidence-based fact that new grads will not be proficient in critical thinking at the end of their 16 weeks. But we do have high expectations for them that they are starting to critically think, that they are, again, starting to work that muscle. They're starting to exercise those critical thinking uh, strategies. Tier 4, so this is going to be admissions, discharges, transfers, and more communication. This is really where we want you guys to, at this point, we are hoping and that they should be handling their own assignments for stable patients, that they're able to handle a double bubble, that you know, 3 babies is still going to be tough. There's time management skills there, but that this is a time where you can take on a hands-on care, have them go see the admission, have them go see a discharge. It's hard for us to always have these experiences right in our assignment. You can always add them to the wish list for us, but you guys know sometimes babies, you know, you sign up for a DR assignment, sometimes babies don't come. You're planned for a discharge that day, the baby doesn't go home that day. So I think that just advocating for those experiences, make sure that the experience is appropriate for them to see. Ask the nurse that's admitting or discharging, is this something I can allow, you can have my orientee come in and just observe this experience. This is really kind of those moments where we do need you as preceptors to advocate for them. Tell them, yeah, go see those things. Go get that experience, go on that field trip, things like that. And then our final tier is tier 5. So really this is just full workload management. At this point, I am asking you as preceptors to really take a step back, that you are letting them handle the workload, that they are managing the workload completely in assignments that are appropriate that they would have coming off of orientation. I want them to start delegating to you. I want you to help them with that delegation and that prioritization, help them exercise those skills. It's not going to come naturally to them. I think a lot of times people are either going to over ask for, I need help with X, Y, and Z. I want you to tell them, that's not going to be feasible when you come off orientation. You're going to need to, take on these skills, but this would be what is appropriate to delegate to your point person, to your resource, to whoever they're asking for help. I want you to play in that role though too. I want you to help them and make sure that they're asking the right person, that they're being proactive in their delegation, that they're not just asking like, hey, I have an MRI to go to and I have no idea what's going on. I don't know what to do. They do, they know where they can go first, proactively utilizing their resources of going on Teams, printing off their MRI checklist, getting their go bag ready to go. There's on the MRI checklist very clearly spells out what the things that they need to take to MRI. But then going to their resources, going to transport, if they need to go to RT, if they need to go to the provider, really helping them figure out how to utilize their resources when they come off orientation, because they are going to come off, they're going to be overwhelmed, they're going to get behind, they're going to have to delegate. So that's really where I want you guys to help them in that practice of knowing who's the right person to go to and what is the right task to ask them to help with. So why TSAM? So new hires, they may struggle with the workload, with prioritization and organization. And a lot of times, I think this was from previously from COVID, we're kind of getting out of this rut, but a lot of times people are coming to us off of nursing school with less clinical and hands-on experience that we experienced previously. So unlike that divide and conquer, this is your patient, this is my patient, they get more opportunities to practice time management. They we see with this, incremental model where we are dividing and conquering, they struggle more with time management, especially when we get to 3 babies. they never get that experience of like having the full assignment in their workload until they're right before they're coming off orientation, and that does them a disservice. So that's really what TSAM has helped with and has really eased that transition into our new hires being independent, especially for our new grads. So getting into some feedback, we are going to have at the end of this at 8:15, Mara is going to sign on to talk about feedback. This is something that, we don't take lightly. We know that feedback is hard to give, but we want you guys to be looking at it as it's something that isn't punitive. These are actually can be very easy conversations to have if you just have the right tools. We don't want you guys to be looking at it as punitive or something that needs to be uncomfortable. Is it uncomfortable? Yes, it can be at times, but that's what Jordan and I are here for. We don't want you doing these things alone. If you feel like that there's a moment, where feedback is needed, always want you to be able to feel like you can give it in real time, but please, escalate to us afterwards. Just send us an email. Hey, I needed to give feedback on time management. I needed to give feedback on asking questions, whatever that situation was. Like I said, in real time is the best. Even if you feel like it's early on, and if you're unsure if it's a true concern, again, we don't jump on every opportunity that, oh, Chelsea came to me, gave me feedback, I'm going to jump on this and say something right away. It might be something we just sit on, it might just be something we want to just take note of and we'll address later. But so important for us to have, and I'll be so thankful later that, oh, thank goodness Chelsea sent me something about this earlier, and we're still seeing this continued concerned pattern. Please help us with bringing up this feedback in real time or in the check-in setting. We're not there. Unfortunately, Jordan and I aren't there in real time. So we can bring these things up organically. We can have these conversations ready to go and make this conversation, very graceful. But if you guys aren't bringing this up to them in real time, it just doesn't hold as much weight. And if they kind of just continue to deny, like, oh no, everything's going fine, this is going great, and we're kind of sitting in the check-in, even with us bringing up kind of prompting questions, it doesn't get us to that ultimate goal of them having that self-awareness of, the things that are going on here. Again, please fill us in prior to the check-in so we can help facilitate these conversations. I can ask questions about time management if that's been an issue, or I can ask about, them needing to escalate questions or noticing or being aware of their boundaries. So just make sure that we're aware, just so that we can help you have this conversation. I know I brought it up a couple of times, but sending us feedback in written form really is the most ideal for us. I love a phone call. I love to, see you guys after you've given a report and you want to stop by the office. That's wonderful. I love any time that you guys want to come in and chat. But we really do love to, hear what has happened in written form. It's just easy for us to share. We get a lot of feedback. So for us to get feedback from you guys and having to type it up, it's just adding one more step for us. If you guys just type up the things that you're witnessing, or even texting, if you want to just text it to me, that's helpful as well. And it really just helps with our workload with giving the feedback to the orientees. So feedback in real time. So finding the right time. Of course, it might not be the right time in that moment to give feedback to somebody when you're in the middle of patient care. Maybe the doc's in there or parents are in there, might not be the right time. But I think that in that debriefing of it all, when you guys sit down to chart, when you guys sit down at the end of shift, asking them, so, how do you feel like that went? Give them the chance to be self-aware and say, that could have gone better. That could have been something, I could have done X, Y, and Z to make that situation better or smoother. In giving feedback, it's always nice to give a compliment and then add the constructive feedback on the end. You're doing really great with time management. I feel like you've really picked up and you're getting out of the room in 20 minutes, which is wonderful. I think that, the next thing that I would like to work on is our conversations with parents and making sure you're including parents in the time management. A lot of times what people will do is give a compliment and then they'll say, but. A lot of times that orientee will only hear the but. They won't hear that compliment that you just gave them. So try and drop that but, give them the compliment, but then add at the end, this is what I want to work on next. This is the next goal I want for you. Again, talk to Jordan and I. We have tips and tricks to have these conversations, make it graceful, make you comfortable, allow them to be comfortable, have us be involved, whatever you feel comfortable with. When you guys come to us with feedback, we tell you the steps of like, okay, this is how this looks. I can give the feedback. We can give the feedback together. We like to paint the picture so that you're aware, you're not in the dark of how it looks. Okay. Because you guys are the most important piece to all of it. So when to escalate. So I'm going to go over these just really quickly, but I feel like a lot of times people are like, well, I just don't know, like, when am I supposed to come to you? So the red flags that we see are, things like not following unit policies, attendance issues. Again, you're not seeing them till you're giving report, or they're not attending huddle. Arriving late to work is any time after 7 a or 7 p. Longer than normal break times. If you were like, where did they go? I don't know where they went. They've been gone for 30 minutes and this was just a snack break. Let us know that. Not adhering to dress code, sleeping during night shift. I know it's crazy. We hear it all the time though. People fall asleep on nights and we've got to have the conversation with them about it. It's a huge safety risk. Being productive and proactive. Are they looking for things to do on the unit? Are they excessively scrolling on their phone? I know that sometimes this is just something that they're doing because they're also seeing it on the unit. But they shouldn't be excessively scrolling on their phone. There's so many things that they can be learning. But please making sure that they're not doing that. Working on assignments during shifts. We're paying for them to do assignments outside of work. So unless there's like extreme downtime on your shift, I don't really want them doing assignments on their shifts while they're with you guys. I want them to be learning from you guys, learning from experiences, things like that. Are they advocating for themselves for experiences? I would like to see an admission. I'd like to see this. I'd like to see that. Lacking ability to retain basic info. So are you having to do multiple reminders of basic information that you've taught them? This can happen sometimes, but after feedback is given or after we've changed maybe a teaching strategy, this is something we do want to look into. Why aren't they retaining information? Are they struggling with the basic workload management? They're not able to handle, a basic double bubble, a room air high flow, nothing really else critical going on here. And we're also timing, getting towards the end of orientation. Are they unable to demonstrate comprehension of skills or concepts that were previously taught? So again, just they're not able to demonstrate comprehension. They're not able to demonstrate a skill back to you. Lack of awareness on limitations. This is huge. So if they are having blind confidence, they're just doing things without asking you. They're not seeking guidance when needed, or they're not asking questions. This is something that is a huge red flag. Please, please escalate this to us. Loving the NICU. The NICU is not for everybody. We have a new grad heavy cohort. Most of the time, they're right out of nursing school. Sometimes it's really hard to, know what you want to do for the rest of your life right out of nursing school. It's okay for them to question it. We want them to feel like it's a safe place for them to express a desire to transfer, or maybe just even, expressing that they're not sure if this is for them. I feel like sometimes all of us have been through that kind of questioning of it all, but we want them to feel like this is a safe place for them to do that and that there's no judgment. How do they act with our babies? Again, just things I've had to deal with in the past. Just odd comments, apathy towards our patients. How do they react with families who need a little extra TLC? If they don't have that empathetic nature towards families that are going through something, or our babies, no less, and they're just starting off here, it's just always something I like to address. I like to visit. I like to just, put feelers out for it. Again, might not something I jump on right away, but something that I just want to be aware of. Okay. So we'll go over that in a second. I think, Mara, are you on? I thought I heard her.
Yes.
Hello. Okay,
Officer
so
Watts. Yep.
we have this fun picture of Mara here. We're gonna do some just some constructive feedback with Mara. I think this is a great segue, just talking about some of the escalation needs. Just to give you kind of a brief overview. We do have small groups for the fellowship with Mara, things of like how to be novice, how to, handle feedback that you are getting from your preceptors, things that come up that just with being new in a new environment, starting a new job, that we have found that have, these have just been issues that have come up for our new team members. So we want to offer them support, a safe place. So it's been a wonderful implementation to add these small groups with Mara. So I'm going to let Mara take the lead. Do you want me to stop sharing, Mara? Do you have?
I have a couple slides, so if you don't mind,
Okay,
that'd be rad. But
cool.
this picture is
Yeah, I'm bummed we
classic.
have to take it down, but all
I
right.
almost wore sunglasses. I should have just
Oh,
for
yeah, that would have been
you
good.
know. Well, thanks for having me. Yeah, I've threw together like a few slides just to keep, it's really just to keep myself kind of organized here. Please hold. You guys see that? It's kind of trying to work. Okay. All right, so this is not new stuff probably that you've heard from me, but I wanted to look at it kind of with this lens of giving feedback, of having to sit and share something vulnerable with somebody and then having to receive that. It's very hard, and our body often does go into some sort of response. So I wanted to remind you about fight, flight, freeze, right? So many of us go into one of those sort of stress reactions when we're having to sit and listen and either give vulnerable feedback or receive it. I'm definitely the fight. Like I'll be like, whatever, to my boss, and then have to like circle back and be like, my bad. Like that was cool, right? So again, just getting to know what your tendency is. Are you a fight, flight, freeze kind of person? And then fawning is the one where we see a lot of people just sort of avoiding conflict and saying like, yep, 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 yep. So how often do we just say yes or okay to get out of a conversation that makes us feel um, uncomfortable, right? So again, looking at some of these behaviors, not only in like in yourself, but also in the new grads, new students coming in, I see that a lot, right? They think they should know something, they tell you they know something, and then we get into this loop of kind of not understanding where people are. All right, mirror neurons. We know that we fire off neurons in our brain that also fire off other people's neurons. So really taking that into account when you're going in to give information. If you can keep yourself as calm as possible, the person receiving the information is also going to be able to be as calm as possible. If you feel yourself start elevating, maybe just ask yourself, is that me or is that the person? And can we just take a pause, right? Do some grounding. So we know that our body operates electrically. Again, what we just said, that it's going to fire up somebody else's neurons, make them feel a little bit more stressed or calmer. So knowing that we operate electrically and that you can do some grounding, I would bring cold water with you if you're going to need to give hard information, or a mint or something that you can hold that reminds your body that you're good, that you're safe, that this is vulnerable, and that you know how to do this. So work on knowing how you are, right? Taking deep breaths, using taste, smell, change of temperature. So that's why the ice water, that's why, an essential oil, that's why the mint, something like that. Using deep breaths to help regulate the other person, knowing that you can do that, that you have a little bit of that power. And notice how you feel before and after a hard conversation. It'll give you a lot of information about how that went and how people were feeling during the conversation. I think acknowledging that something is a hard conversation before you have that conversation can actually help everybody just feel like a little less elevated. So I know this is a hard conversation to have. I'd like us both to acknowledge how vulnerable that can feel, right? So then you're leading by example into that vulnerability. Can you tell me how you experienced that, right? Really getting somebody else's opinion and sort of what were you seeing? Because it's not going to be the same as what you saw, right? I remember something similar from my orientation, just knowing that connecting with somebody can automatically help that stress response feel a little bit different. If that happens again, how can I support you? If that happens again, this is how I would feel best supported, right? You can lead with some of that, with that vulnerability. And again, just like this is what happens to me in those moments, right? I get elevated, I can't hear anything. We're going to need to talk about it later, right? Something like that. You can lead with some of that. And then I wanted to remind you again of our cognitive biases that all human beings have. So, because again, I think this will really help not only with your own kind of like process in becoming like a really good teacher, but also working with students with orientees. So, confirmation bias, right? We interpret beliefs that we interpret information that we get into our own beliefs. Right. So once we've decided somebody is really hard to work with, it's really hard to get out of that because you're assuming that everything that they do is really hard. right? The anchoring bias, we tend to focus on the first piece of information that we get about somebody. And then everything else that we receive from them tends to go through that filter of the first thing that we learned about them. Okay. So if somebody told you, the Sunshine Family thing, hey, it's a really hard family. Well, now are they a hard family, or is everything that they're doing just fitting into that filter of them being a really hard family? Right. Attribution bias. So again, we tend to explain the behavior of others based on a trait, and we explain things that happen to us because of situations. So, right, like I was late to work because I got a flat tire, but if someone else is late to work, we might say like she just doesn't, she's lazy, right? We tend to really do that to other people as opposed to ourselves. The
Hey,
halo
Mara,
effect.
did you
Yeah.
switch slides? We're just still on the
Yeah.
body reaction. I just wanted
Oh,
to let you know.
I'm on cognitive biases in my presentation.
I'm seeing body reactions, the fight or flight. We're still just on slide one.
I can see
All right.
cognitive bias.
You
Oh, you
can.
can? Oh.
I was like clicking next as she was going forward.
Oh, you can click next. Oh, that's nice. Okay, continue. That's what other
That's
people
what
are
I
doing
meant.
too.
Yeah.
Okay,
Thank you
sorry.
for awesome. No, that's awesome. The halo effect and then availability bias. We tend to, again, just any information that we remember quickly, we tend to give more weight to, right? So if we remember a commercial that we saw, that's why those work. Because again, you're just picking what's the most available, not necessarily what's the most true. The Dunning-Kruger effect is that people overestimate their abilities. So a lot of times new students, right, might think that they know how to do all of the things, and everybody kind of judges themselves as above average, which is really cute. So again, just knowing that people tend to overestimate some of those things. The ostrich effect is that you avoid unpleasant information. I can think of a few families on our unit right now that I think are ostriching pretty hard right now to not look at things, right, that are uncomfortable. The negativity bias, we notice and dwell on the negative more than we do on the positive. So popping in, Carly, on what you were saying about how to give information and sort of sandwiching all of that and knowing that the person is going to focus on the negative more than they focus on the positive. And then the spotlight effect is really interesting. We tend to overestimate the amount of time that other people spend on us and our own things and paying attention to us, right? So let's say something happened that was embarrassing on the unit. We might be up all night thinking that people are really thinking about how embarrassing that was, and no one's thinking about it. You are thinking about it. Right. So just some things that I always feel like are helpful for me to read back through and to actually like be a little bit like press myself a little bit. What are these confirmation biases that you are falling into as a human being, right? And we do this we all do these all the time. So really like getting personal with yourself and which ones do I do more often and how can I just like take a pause and look at that? What you got? Questions, comments, thoughts? All right, good luck out there. I'm gonna get the kids to the bus and I'll see you in there.
Thank you, Mara.
All right.
Appreciate your time. Yeah, we wanted to invite Mara because we really do understand that feedback conversations they're hard to have. But we, want you guys to have all of the we want you to have all the tools. We want you to have all the places you can go. Um, if you don't feel comfortable coming to us, going to Mara, and we want that for the fellowship as well. So always just want to make sure that you guys are feeling set up for success and all the things. Okay, so just a couple more things to kind of close out our meeting really quick. So health stream. So health stream checklist. So you guys will be responsible as preceptors. You are the only ones that can sign off their health stream checklist. I will show you guys what that looks like. Those of you that are new to precepting, we are giving access to the evaluate checklist link. And we'll show you guys how to get there. This checklist is very long, so please just check it every week. There are things that are going to be on there that you may not see, like bereavement care with your orientee, but as long as you go over, bereavement care with them, you show them the resources we have on Teams, you tell them about the team members to go to for these, kinds of situations and experiences, that is sufficient to say that is met on their health stream checklist. This is what it should look like. So you'll log on to HealthStream, right on your My To-Do list. You'll see over on the right-hand side options, and it'll say Evaluate Checklist. You'll just click on that, type in your orientee's name, and their checklist will pop right up. You will continue to save your progress as you go through orientation with them. I just suggest you to do it, each week that you're with your orientee. And then whoever is with their orientee the last week, it usually will just be, their responsibility to actually submit the checklist. It should not be their responsibility to complete all of it because that's way too much to put on one person, but it will be just your responsibility to click submit because it will not fall off their to-do list until you actually hit the submit button at the bottom. If we have sent access for all of our new preceptors because, you'll be taking this class that gives you access, or this, Teams. If you do not see this evaluate checklist option, please just send Jordan or I an email and we'll reach out to Lisa Robinson for figuring out why you guys just don't have access quite yet. Let me just pop to preceptor education really quick. So there is also a preceptor class that you can take through HealthStream. It's an in-person class with some online pre-work. You will just look up in the catalog of HealthStream, Inova RN preceptor training. Some of you I saw are actually in this class. The next class that there is 3-3, which is next week. That class is unfortunately already full. For those that are interested in taking the Inova precepting training, there is going to be a change in 2025. It looks like it's going to be more online work. But I'm not sure if they're going to be following up with an in-person class. We haven't really even been filled in on what the updates to that preceptor class looks like for 2025. But as soon as we get those updates, we will send them to you. Changes to come. We will let you know and update you as those get dropped to us. Precepting in the SBU. So unless you have gotten the SBU training, we do not have you precepting in the SBU. The rules are different, expectations are different. The orientee should never be alone in the SBU. It's appropriate that if you are precepting them in that neighborhood and with that micro preemie population, that there is a mild regression. It's a very intimidating place to be. You will see a regression in their skills. They feel like they can't do as much. So, don't panic if you think like, I don't know who, last week they were doing great being independent and now I'm just starting to see that they're second guessing everything. They're not, doing the things that they need to, but there are things that they can still do in the SBU independently. They can initiate cares. They shouldn't be doing cares on their own though, of course. They can be grabbing all their materials, going in early, prepping for hands-on care, making a care plan, starting to correlate, connecting the dots, asking questions about, what they're doing for this baby, why they're doing it, digging into the provider notes, things like that. They should be answering alarms. You shouldn't have to be prompting them to, okay, let's get up. That's our baby. They're desatting. We got to go in. But they should never be answering alarms alone. You should be hot on their heels, right behind them, helping them, do all the proper steps for whatever that baby needs. And then looking for experiences, SBU admission, field trip, pick placement, things like that. Please no inline suction on IVH bundle babies. That's the only, big no-no for those kinds of cares. We do have a practice doll that is, I think it's now in the meadow or the rainforest. We've been using them for the trach babies for parents to practice, but we have a baby that's intubated that has an inline suction. I always like to have my orientees practice on an actual baby doll first and then, then do an inline suction on a baby. Just do it in steps. Reach out if you have precepted in the SBU and you haven't taken the SBU class. We want you to feel like if you're not feeling comfortable, you've been put in a situation where you've had to precept in the SBU and you haven't taken those courses, please let us know. That's something we can escalate to the unit supervisors and say, hey, please, we're just not ready for this yet. Let's keep them in the ICU. Kind of a thing. If you are looking at your schedule, you will see that SBU is coded differently in the unit schedules when we send them out to you guys. This is how it will look. SBU is coded in this kind of orangey red color. Day shifts are yellow, night shifts are gray, and then SBU is this orange color. We are also, I was telling you guys, we're coding things a little differently. If you guys request to us like, hey, Karina's really needing some Nava, Nipiv, if not a one-to-one. This is how we will code it for our unit supervisors, and they should put that on the assignment sheets each day. Some of you guys may have noticed it's in like a gray coloring on the assignment sheets. It'll say 3 babies or Nava Nipiv or acuity lines. So please let us know if you aren't getting what you're requesting. Again, as preceptor orientees, you guys have priority over assignments, but we want to make sure that that's actually being followed through with. Okay. Okay, and then with Mara. All right. So that's all I've got for you guys. Sorry, I went a couple minutes over. Any questions for me? Anything that the presentation brought up? Any questions with the March group? Anything that I can answer for you guys? No? Okay,
I have a
awesome.
question, sorry.
Yeah. Yeah.
Do you know when we'll have the schedule of when we'll be
Yes.
precepting? Okay.
Yes, so Saj is working on the Saj is who does the schedule for the fellowship for us. She finalized it yesterday afternoon, late afternoon. Jordan is checking it this morning, and we will be sending that out to the orientees by the end of today, and then we will send it out to you guys as well. We usually send it out in the fellowship family email, which we're going to be doing this week, if not today, tomorrow.
Awesome,
So
thank you.
the things that you guys should be looking for in this week is the fellowship family email. So that'll be an email chain with you, your orientee, and everyone else in your fellowship family. For those of you that don't know, we do set up the orientees with, it's 2 orientees to 3 preceptors, 3 to 4 preceptors. We utilize that format just because we have so many new hires and it limits the number of preceptors that we have to use. So we're using 50 of you guys instead of 65, 70. So it brings our numbers down. So that's who will be in your fellowship family email. Awesome. Any other questions?
I have
Yeah.
one. So I was wondering if we have like any say in our assignments with our pairings, because I haven't had a ton of intubated babies, so I just want to be able to be a good
Yeah,
teacher, and I can't do
absolutely.
that if I'm not comfortable. So
Absolutely. No, and when we are putting together the fellowship families, we are very strategic in that if you are newer to precepting, like at least 2 other people in that fellowship family have experience precepting. So for example, if you are with Karina, that's who your orientee is with, we will make sure that Karina gets those experiences with her 2 other preceptors. Again, we're not here 24/7. If there is a day that you come in and that you see that you have an intubated patient, it's just escalating to whoever is there, your point person, your unit supervisor, just letting them know, hey, I'm just not ready for this, and they'll take the proper steps from there. But I will always make note that, Olivia has asked for the lower acuity assignments, the 3 babies, double bubbles, things like that, just so that, that's fresh in my mind for coding and for, wish list assignments when you have your orientees with you.
okay, thank you.
Yeah, but please just escalate to me if things do happen and you're like, I keep getting sick babies and I don't know what's going on. So I can handle it from there. Okay. Awesome. Any other questions? All good questions.
If we need to
Awesome.
make oh, sorry.
Hey T, no, go ahead.
If we need to make schedule switches after the schedule is finalized, do we need to email you too, or?
Yes. Yeah, so what would be best is you putting the switches when I put you guys into those fellowship family emails, all switches will go into those fellowship family emails. That's how you'll tell your orientee, hey, I moved off of this day to this day. It gives them the opportunity to, because not all the time they can make those switches because we've already sent the schedule to them. So it gives them the opportunity to say, I'm able to make that switch with T or I'm not able to, and then we'll either put them with a fill-in or we'll switch their schedule to be with you. And the biggest thing with the fellowship family emails, guys, is please, please, please just always make sure you hit reply all so that it goes to the entire team, not just to to who you're ever replying to. It'll just go to one single person. If you just hit reply, just make sure you hit reply all, so the entire fellowship family is aware of the switch or a schedule change, whatever. Okay. All right, all great questions. As questions come up, please email me, call me, text me, whatever. You know, seeing some of the faces on the screen, I'm really excited for you guys to Precept. I know that probably some of you guys are nervous, but we really have chosen you guys for a reason. We've gotten wonderful feedback of you being supportive of somebody new, you being resourceful, you being a shining star on the unit, whether it's to a new team member or to leadership or to us. We're very excited for you guys to take this next step, and please just bring all the communication to us. If you're concerned about something, you have questions about something, Jordan and I are here for that. We want to hear it all, the good and the bad. Okay. We want to know how we can do better, how we can help support you best we can. All right. Okay. All right, guys. Well, thank you so much. I know we went a little bit over, but I think all for really good questions and things like that. So please just let me know if you guys need anything, and we'll be in touch this week. All right. Thanks, guys.
Thank you.
Have a good morning.